Testosterone serves as the foundational hormone in bodybuilding, essential for muscle growth, strength gains, and performance enhancement. While natural testosterone production in men typically ranges between 3 to 10 milligrams per day, bodybuilders frequently use doses far exceeding physiological levels to push muscular development beyond genetic limitations. A weekly dose of 1000 milligrams represents an extreme, approach substantially higher than what most athletes require and carries both significant benefits and serious health risks. Understanding the full scope of this dosage is critical for anyone considering its use. Anabolic and performance effects at 1000 milligrams per week. Testosterone propionate, or enanthate, delivers an overwhelming anabolic stimulus. This dosage represents approximately 10 to 20 times normal physiological production, flooding the body with androgens that dramatically enhance protein synthesis, nitrogen retention, and glycogen storage. The effects translate to rapid muscle growth, accelerated recovery between training sessions, and substantial improvements in strength. Users typically observe noticeable increases in muscle size within weeks. The enhanced recovery capacity allows for more frequent and intense training, further amplifying progress. Testosterone also stimulates red blood cell production, boosting endurance and reducing workout fatigue. Additionally, improved nutrient delivery and subcutaneous water retention enhance vascularity, giving muscles a fuller and more defined appearance. However, muscle growth follows a nonlinear pattern. The body has limits on tissue synthesis rates. While 1000 milligrams of testosterone will undoubtedly maximize hypertrophy, the marginal gains beyond 500 milligrams may not justify the exponential increase in side effects. Estrogenic side effects and management. High-dose testosterone presents significant challenges due to estrogen conversion. The aromatase enzyme converts testosterone into estradiol, and at 1000 milligrams weekly, estrogen levels can become problematic. This leads to several adverse effects, including gynecomastia, where estrogen stimulates breast tissue growth in men, potentially causing permanent enlargement if unaddressed. Water retention becomes another concern, creating a puffy, bloated appearance and contributing to elevated blood pressure. Mood disturbances such as irritability and emotional instability may also emerge from elevated estrogen. To mitigate these effects, bodybuilders typically implement aromatase inhibitors like anastrozole or exemestane. These compounds suppress estrogen synthesis, but require precise dosing. Excessive use can crash estrogen levels, leading to joint pain, sexual dysfunction, and impaired recovery. Achieving the correct balance proves essential for managing estrogen-related complications. Androgenic side effects. Beyond its anabolic properties, testosterone exerts strong androgenic effects that become particularly pronounced at 1000 milligrams weekly. Acne frequently develops due to increased sebum production, often appearing severely on the back, shoulders, and face. Those genetically predisposed to male pattern baldness may experience accelerated hair loss, while others notice enhanced facial and body hair growth. Behavioral changes also occur in some users, with heightened aggression and irritability, sometimes referred to as roid rage. While some athletes accept these effects as inevitable, others seek mitigation strategies. Dermatological treatments like isotretinoin for acne or antiandrogens like finasteride for hair preservation may become necessary for sensitive individuals. Cardiovascular and metabolic risks. The cardiovascular implications of high-dose testosterone use represent one of its most dangerous aspects. Testosterone adversely alters lipid metabolism, reducing HDL while increasing LDL. These changes promote atherosclerosis, elevating long-term risks for heart disease. Hypertension frequently develops from combined water retention and increased red blood cell production, placing additional strain on the cardiovascular system. Prolonged use without proper monitoring significantly raises risks for myocardial infarction, stroke, and other cardiovascular events. Implementing regular blood work. Cardiovascular support supplements like omega-3 fatty acids and CoQ10, and diligent blood pressure management becomes critical for harm reduction. Hormonal suppression and recovery challenges. This dosage completely suppresses natural testosterone production. The body detects excessive exogenous testosterone and ceases signaling to the testes, resulting in testicular atrophy from disuse. Sperm production often halts, potentially causing temporary or permanent infertility. Users frequently develop dependence on external testosterone, so the endocrine system struggles to resume normal function after prolonged suppression. Post-cycle therapy employing SERMs like clomiphene or tamoxifen becomes essential to stimulate natural testosterone recovery. However, after extended use of 1000 mg weekly, full hormonal restoration may require months, with some individuals never fully regaining baseline function. Liver and systemic stress. While injectable testosterone lacks the direct hepatotoxicity of oral steroids, extreme doses still impose systemic stress. The kidneys face increased metabolic demands, and elevated red blood cell counts can cause blood thickening, raising thrombosis risks. Regular monitoring of hematocrit levels and liver enzymes becomes imperative to identify potential complications early. Psychological and cognitive effects. High-dose testosterone significantly influences mental state. Many users report enhanced confidence and training motivation, but others experience problematic psychological effects. Increased aggression can disrupt personal and professional relationships. While hormonal fluctuations may trigger anxiety or depressive episodes, individuals with pre-existing mental health conditions prove particularly vulnerable to these neurological impacts. Long-term health consequences. Sustained use at this dosage carries severe implications. Permanent hormonal imbalance may necessitate lifelong testosterone replacement therapy. Cardiovascular damage often accumulates silently, manifesting as heart disease years later. Prostate enlargement becomes a legitimate concern, with androgens potentially accelerating benign prostatic hyperplasia. Perhaps most insidiously, many users develop psychological and physical dependence, struggling to maintain their physique without continued steroid use. Conclusion: the use of 1000 mg testosterone weekly represents an extreme bodybuilding strategy suitable only for experienced users with comprehensive understanding of the risks. While the regimen delivers exceptional muscle and strength gains, the associated health consequences, cardiovascular damage, hormonal disruption, estrogenic complications, and psychological alterations, demand serious consideration. Most bodybuilders can achieve excellent results with lower, safer doses in the 500 to 600 mg weekly range. Those opting for 1000 mg must implement rigorous health monitoring, including regular blood work, cardiovascular assessments, and meticulous estrogen management. Ultimately, the long-term health trade-offs frequently outweigh the temporary physical enhancements. Reserving this approach primarily for competitive bodybuilders under strict medical supervision